Well, it is National Wear Red Day, and joining us to talk about that this morning is Dr. Tracy Stevens from St. Luke's Health Systems. Good morning, doctor.
Good morning.
Thank you for joining us.
Yeah, so this is a big day. Tell people why they should reach for the red in the closet today.
Reach for the red. It is National Wear Red Day, and this was launched over 20 years ago.
Wow.
Where the first Friday in February is we encourage all to wear red to raise awareness about women and their heart health, recognizing heart attack and stroke remain the #1 cause of death in women.
Wow. For so many years, people thought of heart attacks and stroke as something that was more of a men's issue. This is just absolutely not the case. And so what kind of education did it take to sort of shift the thinking, to let people know this is also a women's issue?
It was recognition of these statistics that more women than men die every year of heart attack and stroke. And we're really proud at St. Luke's and our Women's Heart Center to have recognized this even 10 years prior. Being the first women's heart center in the country, one of the big things is just raising awareness. This is our #1 health threat, but empowering women to take ownership of their health. And it's a scenario where if we are on board with basic strategies, the best way to treat heart disease is to prevent it.
Yeah, and I feel as though I've read, Doc, that the stressors for heart disease and the risk have only been elevated during the pandemic for some obvious reasons. Is that true?
Absolutely. You know, it's easy to measure numbers and do statistics. It's hard to measure stress.
Right.
But stress is a major risk factor for heart attack and stroke. And the studies do show stress in women is far greater of a risk factor than in men.
Interesting. So it affects women at a greater level.
Absolutely.
Interesting. Yes. And so what sort of things do you have planned for the month of February to raise awareness and educate people on the risks?
A number of the events in our Women's Heart Center at St. Luke's, it's education. So giving credible tips on what people can do to take ownership of their health. It's important to know the majority are lifestyle. So it's eat healthy, stay active, ideal body weight, don't smoke, limit alcohol, avoid prolonged sitting. We're doing a lot of education about these risk factors and also recognizing it's not just about heart attack and stroke. There are very unique conditions in women, far more common in women. Stress cardiomyopathy, preeclampsia, spontaneous dissection of the arteries, that we are doing a number of educational series to raise the awareness, encouraging women to take ownership of their health. The best way to treat heart disease, again, is to prevent it.
Right. And what, real quickly, besides wearing red, what can we all do to show that we're on board?
I think make sure yourself that you're doing all the basic strategies. It's discipline. If I could pick one thing to encourage all of us is check your blood pressure. It's the silent killer. It's the most neglected condition in our country.
Wow.
You can't see it, you can't feel it. So measure it the 15th of every month. Have your own blood pressure cuff at home. Valentine's Day is coming up. Get you a blood pressure cuff.
Yep.
Know that it's controlled and bring your diary of your blood pressure into your provider. And really call us anytime at St. Luke's Women's Heart Center. We are available to help you navigate preventive strategies for your cardiovascular health.
Thank you so much.
Right.
Dr. Tracy Stevens, I appreciate you joining us.